Hey, it's a good day, everyone, at Future Media TV, and we are having a special program today. Steve Baker of Healthcare Peace of Mind with Steve Baker today, and Steve is a phenomenal resource on your Medicare coverage. And what we want to do today is talk a little bit about the Medicare, and not only, Steve, Medicare as it relates to when you turn 65. However, we want to also go in a little deeper about what takes place, after you turn 65. I mean, there's some opportunities here that you can actually help people after they're 65 when they stay healthy. Before the show, we were talking about some of that, and I just thought, let's have Steve talk about that and explain a little bit more. So, Steve, how you been? Tell me.
Doing great.
Update. What's going on?
Well, I've been staying busy, really busy, out seeing folks and so forth.
Busy is good.
Exactly.
As long as it's the right kind of busy, right?
Exactly.
So let's talk a little bit about, the initial healthcare procedures. We've covered in previous shows, the different sections, A, B, C, and D, and some of the, what are they called? The additional coverages that you could purchase?
Mm-hmm.
What are they called? I forget them.
Well, A, B, C, and D is the primary, and then you've got the supplement to go along with that.
Okay.
To essentially give you 100% coverage if you're on traditional Medicare. And there are others, there are other ways you can go too. So I'm about helping people and showing them their options so they can make an intelligent decision about their future health care once someone turns 65. And I'm also helping a lot of people thereafter, after age 65, to meet with them and update their coverage price-wise to make sure that the price that they're paying for their coverage is in line with the market that's out there.
Well, and as you know, as well as anybody being familiar with the industry, just like any other industry, people change, companies change, plans change. Mm-hmm. So we really have to be friends with somebody like yourself in order to, have somebody that's up on the market, find out what's going on. Because these companies evolve, their pricing changes, their coverage changes. Sure. And so you don't want to be stuck with something that's going to be more expensive than what you want to necessarily pursue, right?
Sure.
You want to be priced at a place where you can actually get the best deal possible for that moment in time.
Correct.
So, and as we're not getting any younger, it's really good to be able to investigate that pricing before you need it, because once you need it and, you're maybe in some health situation, it's a little more challenging to receive that coverage, I would imagine.
Sure.
So what are things that we can look at or share with the audience that would be some of that area? I mean, is there, and I know you'll go into a little greater detail, just some highlights. What are we going to be talking about?
Well, one thing that I'm finding is that as the years go by, if someone gets on Medicare with a traditional supplement, that it just kind of goes into neutral. In other words, it's just kind of runs on autopilot, right. And it's drafted out of the checking account, and there's a raise here and a raise there, and here and there's a raise. And before you know it, you get a letter in the mail and it says, oh my, it's going up and going up, kind of like auto insurance and everything.
Right.
And it's, right. I know myself, I'm guilty. I have my auto insurance with one company, and I've been with them for years and years and years. And I have to take a major effort in order to take a look at it to see if I want to change and compare prices and stuff. So the price rate increases with Medicare supplements are uneven. Some companies like to go up a lot. Some companies like to hold it as steady as possible.
Right.
But over a period of time, it's amazing how many people, in terms of price, get out of kilter with what's actually out there in the market.
What do you think causes that, Steve?
Well, it's just one of it's a quirk in the law of Medicare. Someone who offers Medicare supplements, and by someone I mean a company, of course, that offers Medicare supplements. The company is free to change premiums at will. Well, not at will, but they have to apply for it through the state insurance commission. But they can apply for a large amount, and the insurance commission says, no, not quite that much. Why don't we knock it down some? So over a period of time, their rates get out of kilter with what other companies are offering. Right. And one of the things about it is that they're all the same.
As far as the coverage goes.
As far as the coverage goes.
Isn't the coverage mandated by on a federal level? I mean,
yes, the actual coverage is mandated on the federal level through the Center for Medicare and Medicaid Services, the CMS. That's the administrative arm for Medicare.
Wow.
So they they monitor that very closely, and all the companies are strictly required to pay their claims on a timely manner. So that's not an issue either. They all pay once the claim hits the Medicare, once the CMS, right, it's paid. So there's no issue there whatsoever.
So the other thing,
go ahead.
Well, I was just going to say the other thing about that is, insurance is, I believe the term is called an action. They're based on actuarial tables of how much exposure the company has, and
exactly
how many clients they have, and some companies decide not to have coverage because they don't have enough business in that arena, right?
Mm-hmm.
And is that a challenge?
Yes, that's true, and they'll elevate their premiums in order not to bring on so much more business if they don't want to.
Right.
So in other words, they're free to throttle their input down.
They'll push it out the door, right?
Yeah. By raising up even their initial premiums, they'll raise up.
Oh wow.
So that's it just makes it an uneven trajectory through a period of time, and it just pays to sit down, perhaps with someone like me, to say, okay, this is what I'm paying for my Medicare premiums, for my Medicare supplement premiums. So is there a comparison out there? Can we look at it?
Right.
So, one of the major caveats that we have is someone's health. Now, you may remember from some of my previous presentations is that there's a 6-month window on either side of someone's 65th birthday where they qualify health-wise automatically, no matter what their past history is. They can qualify in that period of time. After that period of time, in order to change over, they must be presented with a number of health questions, and it has to go to the company's underwriting department to determine if the company is willing to accept that person. So my issue is that if someone has a question, they can call me and talk to me, and I'm a laid back person. I'm not interested in going out and just, writing helter skelter a lot of insurance on people if they don't need it. But I can tell them real quickly whether or not it looks like they can qualify. And I can also present their case to more than one company.
Right.
So I can see if a few companies have lighter underwriting standards than other companies.
So underwriting, explain that for someone that's not involved in the industry, because I mean that doesn't mean anything to a lot of people.
Right.
And essentially how I understand it is that they have to accept you into their club. Uh-huh. And underwriting gets to say, okay, yes or no, depending on your health conditions, your age, circumstance, where you live. Different things. Right.
Yes. Right. That's true. And this applies mostly now with with post 65 people. We're talking about people who've turned 65 and they've used their Medicare for a little while, and those people are still under the old standards of underwriting. You go in and do the underwriting, and there's something that's called the Affordable Care Act, also known as Obamacare. And with that, they're trying to, they were trying, when they put it, it sounds really great to do this. Why don't we just let or insist that the insurance companies just accept everybody? Right. Well, that's fine. So you can compare that to automobile insurance. Yeah. And if they will accept, if your automobile insurance company will accept anybody for any time for any past incidents,
pre-existing condition, you can go, hey, I'm not going to pay that large premium every month or every 6 months for my automobile insurance. I'll just wait till I have a wreck, and then I'll run over to the insurance company and we'll quick put a claim in, and voila, it's fine. Automatically it'll be covered, right?
Yeah. It's the same mentality with health insurance.
Yeah.
And that's, we're off on another subject now, but that's a huge problem with.
Well, it is something that insurance companies need to recognize that will in fact happen. So an insurance company has to go through the process of understanding, okay, what's the market demand?
Right.
Where can I provide that coverage at a cost-effective unit that I can still stay in business and carry my costs, right?
So I'm able to talk to people, perhaps on the phone even, and just ask them some questions about their health. I'm not going to get into that now, but some certain questions about their health and determine if they're eligible. Yeah. And if someone is eligible, they could be in for a nice rate increase for their Medicare supplements.
Yeah.
So husband and wife, on the average, I did last year. I did about 35 of my clients. I moved them over from another company that I used to represent to one of the companies that I presently represent, and the differences in the rates are dramatic.
Yeah.
So I was able to save them a lot of money, and in some cases, I'm just talking about one lady in Pasadena, Texas. I saved about $170 a month on her premium.
That's huge for someone.
That's huge. That's huge.
Older.
Average, it's between $75 and $100. And
wow.
Annualized premium, I was able to save my clients about $35,000 in total premium last year. And that's money that would have gone right into the coffers of the insurance company, never to be seen again. Because if you replace it properly, someone can get the exact same coverage for a different price.
And I think you teed in on it is properly. It's not like shopping for donuts at Krispy Kreme, right? It's insurance, it's your future, it's your health. So
exactly,
we have to encourage the use of a professional and somebody that knows the industry and happens to actually be a participant in the Medicare process, right?
Yes, I'm able to share with someone when I sit down with them or talk to them. I'm able to share what I carry in my wallet.
Yeah,
I'm not going to give it out right now, but I'm able to say, look at this is I looked at all the companies. This is the one I switched my coverage to.
Yeah.
So that's here's the thing. There's a book that once seniors reach 65, they get this book every year. This is the 2016 Medicare and You book.
How thick is that book?
It's about half an inch or so.
Hey, we were going to go into this a little deeper, Steve, and I want to be able to have the screen a little bigger and have you highlighted in the center of this conversation a little bit and present to everyone this process of what you go through and how you decide if they can save money or not. Can you do that for us?
Sure, I can do that.
Because what I'd like to do is I want to make sure that people can actually see this and share this and get this out.
Mm-hmm. Well, we can do, as agents in the business, we can do what's called field underwriting. And by that, we mean outside of the company, I can ask certain questions of individuals about their health, about the medications that they're taking, about their health history for the last 5 years or so. I can, in just about 3 minutes, I can determine whether someone is eligible to make a switch over. So if they are, then I'm able to sit down with them. And out of that book that I just held up, there's a page in there on page 100 of that same book. And if someone has one of these books, they can, Medicare and You for 2016, they can look up and see this paragraph right here that's circled. And I'll read the paragraph. Different insurance companies may charge different premiums for the same exact policy.
Boom.
So it's written there, black and white.
So
page
I think
100.
this is absolutely critical. We talked before the show, and I wanted to drop out of the show and have you go start to finish on this presentation.
Okay.
Can we do that now?
Sure.
Steve?
Sure.
And then when you're wrapped up, I'll come back in, and then we can do a little Q&A. How's that sound?
Right.
If you could explain, take about 5-10 minutes and explain this process to the audience, then we can knock this out. Okay.
Sure, I can do that.
So I'm going to step out and give you a little more real estate here, and then I want you to start from the beginning and share this critical information with the audience. All right?
Sure, be glad to do that.
All right.
Okay, I'm Steve Baker, and I have a company over in LaPorte called BakerSeniors.com, and that's what I do. I've been doing this for about 15 years. And I've helped hundreds of clients get involved with Medicare and their supplements. The unique thing about me, not totally unique, of course, but different from perhaps other people who talk about Medicare, is that I'm on Medicare myself and have been for quite some time. So I'm a cancer survivor. My wife is a cancer survivor. I've had a quadruple bypass that happened about 20 years ago. So I know the healthcare, and I know insurance, and I know how it all works. So over a period of time, what I've been able to do is when someone enters the healthcare field as a senior, we're talking about turning 65, they enter a sort of another world as opposed to what they've experienced up to age 65. After age 65, Medicare has its own rules and regulations, and it's another world unto its own. So first off, for someone turning 65, I'm able to explain where they are and what their options are. After about 4 or 5 years, most seniors begin to notice that their premiums for the supplement starts to go up, drift up and up and up. And a lot of times they pay attention to it. Sometimes they don't. But over a period of time, all of a sudden, you're paying not twice, but I'm going to say 40 to 50% more than what you started off at. So the thing about it is, what I do is I contact people contact me, and we sit down and we evaluate their coverage and see if they can't save major dollars. Last year, when I was with a previous company, I signed up a lot of people. Out of those, about 35 or 40, I was able to move from that company to another company for a lot less premium. Exact same coverage. Medicare and You is a book that Medicare mails out every year. And in that book, on page 100, there's a paragraph with a sentence, and you can see it circled right here. I'll read that sentence to you. It says, different insurance companies may charge different premiums for the exact same policy. And if you have one of these books, be sure and look on page 100 of that book for 2016, and you'll see the sentence that I just gave out. So that means that someone is free at any time of the year. It doesn't have to be an open enrollment period during the year. It can be any time during the year. Someone can choose to switch over to another company if they can qualify for the health questions. And so I do this all the time, and I've been doing it quite a few years. So within 3 to 4 minutes of even a conversation on the phone, I'm able to tell someone whether it looks like they could qualify for a change in their Medicare supplement. And it's important to evaluate that just to see where you are, especially if you've been on, say, you're 72 or 74 or even 68 or whatever it is, just to see if it's possible for you to save some money. And I've done husbands and wives together, and I've been able to save them as much as $200 a month for the both of them. $200 a month now, that's a lot of money. $2,400 a year for both of them if they can qualify with the health questions. Sometimes only one of them can, but at least in the household, there's a dramatic change. And people ask me all the time, well, what about the future? Well, I mean, what's going to happen in future years? No, there's a cliche out there. I don't have a crystal ball, and no one does. But I suspect that over a period of time, no Medicare supplements and no premiums and no health insurance companies, no healthcare premiums have a way of going down. They always go up. And here's the way I like to put it. This is where someone was. This is where they are. This hand represents where they were, and this represents. I'm sorry. This hand represents the new company. This hand represents the old company, and it goes up like this. They both will go up. Understand? They both will go up. But this area right in here between this hand and this hand is thin air. This is the amount of money that's being wasted to the insurance companies. And I'm an advocate of households. I run a household myself, so I know, hey, I'd rather have the money in my household rather than sent to the insurance company, because as I've just explained, you get the exact same coverage with a Medicare supplement from one company to the other. So that's very important to know. And it's very important to take a look. I mean, it doesn't, there's no risk. I'm not a wham bam, thank you, ma'am kind of salesman. I'm just like, okay, let's take a look and see. And the decision is yours. And I've had people tell me, look, I like X company. I want to stay with them. Fine. But here are the numbers. If you want to stay with them, great. Fine, no problem. So I'm down the road. But that's what I do. And I do a lot of that. And I'm able to sit down with folks and evaluate some of their other policies as well and see what they have. There's an issue with long-term care now with people. So I have an answer for that as well. And a lot of people like to stay in their own home when they feel like someone tells them they need to go to a nursing home. I have a cure for that as well. So I do a lot of things for folks. And so it would pay you just to give me a call at 832-754-3292. Good to talk with you. Thank you so much. Bye.
Brilliant, Steve. That's excellent. That covers a lot of ground.
You think that would work?
Oh, I know it'll work. Now the question is we can do these often and test them and try them out. And every message is going to resonate with a different crowd, right? And nowadays it's a matter of, okay, well, how can I use, Stacy was, we had another show over at noon, and Stacy was talking about, the different tools and technology that salespeople can use, just like you using, technology now, sharing this information over this platform to go to another audience. Then we'll share it again on social, and we'll share it again on YouTube, and we'll share it on your website. And somebody, even a blind squirrel gets a nut every once in a while, right?
That's it.
So we just, you just go out there and figure out what is working today. What worked 10 years ago may not be what works 10 years from now, right?
Sure.
So let
me ask you a question about Stacy. I started watching that, and it was on Twitter, and I got distracted, and I had to get off, and I said, well, I'll just get back on Twitter and finish seeing it. I just saw about the first 5 minutes or so of it, and it was very intriguing, and I want to see it again, but I can't find it or anywhere. Can you tell me how to find that show?
Oh yeah, absolutely. What happens is there should be a link in Twitter that you can actually go to the show, because what happens is when we share it, it will play 30 seconds of video or so, and that will allow us to actually display what the subject is, right? And then up in the tweet there'll be a link to actually allow you to go back into the show.
Okay.
It should be. Another option is you can just go to blab.im and just up in the search bar, just type in Future Media TV. And once Future Media comes on, it'll show you the show that's playing. And then you can click on that.
Okay. That is a show that was recorded. So it's recorded now.
It's recorded. It's out there now. So, it's up on our website. You can go to Future Media TV and watch it from there.
Okay.
You can go to, and she's phenomenal. She's we've been brainstorming with her and actually getting ready to hire some salespeople and put some sales in place to get some more shows on the street. So I think it's a really. In fact, I had. Have you seen the Ultimate Business Cards that we've got?
Yes, you showed me that.
Yeah, so we need to get you in line with that, and I'm thinking to myself, okay, well, there's really no reason why that couldn't be a viable product for a lot of people.
Sure.
And that doesn't even require us to be next door, and so we could sell that all over the world.
Yeah.
So I'm talking to some developers to maybe take that and create an app out of it.
This would be like if you're talking to someone and they're a prospect for your business, and instead of saying, "Hey, I'll send you my business card. I'll put it in an envelope and send it to you," or whatever.
Right.
Why don't you just give me your email? I'll send you right now, and I'll give you a link, and you can just check on there. This is my business card. Click that, and it'll tell you all about us.
Exactly. And then they see your personality. They see who you are. They understand what you represent, and they're either going to, much like anything else, they're going to decide, okay, I like Steve. I like his personality. I like his approach. I like his open, honest, understanding of the product, and he can help me.
Sure.
Draw a conclusion on that. So,
right.
If you're a fast talker, and they don't care for that. I mean, everybody knows what they like, They may not know it. They may not say it. And people know what they like. So it's a matter of dropping that personality into their inbox or their phone, bringing that to the light in a very simple, non-evasive way. So.
Yeah, then you're able to add in artwork and certain things, and like you do with me, whatever, all
exactly.
that.
Exactly.
Yeah. It's really quite effective.
I think so. Now, being effective and being cost effective is two different things, right?
Yeah.
We'll see how people respond to it, and see what it will bring into the door. But I've had some good positive reaction for it, so I'd like to believe that it can benefit a lot of people. So we'll see.
Yeah, I would think so, because the old business cards are just kind of, that thing is just, I've got a stack this high, and I keep saying I'm going to go through those, and I was saying the other day I got to get up and go through all those, and I'm going, what for? I mean I don't know. I don't know why I'm going to go through them.
Yeah, what are you going to get out of them?
I might find something, but I don't know. Who is that? Where?
Yeah, we went to a BI 2 years ago, and all of a sudden, Steve who?
Yeah. The guy's a carpet cleaner, and I don't know.
I don't know. Hard to say.
So,
but you have a very focused niche, right? You have a very focused understanding of, a very large industry, and you have this intelligence that you've used. You've been familiar with it. Medicare is all you focus on, and certain coverage in the supplements, and that's, it's a huge undertaking. However,
Sure.
there's a lot of people that need your service and need your help. The only thing you need to do is have them become aware of who you are.
Exactly.
Yeah,
exactly. And the video does that. I mean, I had a choice. I was ordering up some of my military records I have to get my military records for a reason. So there's something that's called a DD-214, which is everybody who's served in the military has that. But over years it gets lost and it's gone and whatever.
Right.
And all of a sudden the VA or anybody says, okay, you gotta have your DD-214. You gotta have it. That's it. Well, I haven't seen that thing in 30 years. What the heck? So you got one option is to go through the government, and it takes you weeks and weeks and months to get your DD-214. Or you can go to this one place, and there were two other options, two other companies that would do it. One didn't have a video, and the other one had a video.
Which one did you pick?
I said, I'm going to watch the video. Boom. That's the one I went to.
You immediately understand what they're going to do, how they're going to do it, and why they're going to do it for you.
Exactly. The process, what they're going to do, explained everything. I see a human face.
Yeah.
Very attractive young lady says, this is what. I says, that's the one I'm going with right there. That's it.
Yeah.
The other one, I just totally forgot. He didn't have a video.
Yeah.
Totally different.
Even Steve Baker has a video.
Yeah. Even I have a video. Exactly. So it's totally, this video thing is just, I think you're, and I know how passionate you are about it.
Yeah. We're only at the tip
for good reasons.
We're only at the tip of the iceberg.
But it's only been, the last 5 or 6 years that it's been available like this in mass, really?
Oh, I don't even think it's been that long, has it? It's been growing. It's definitely been growing. And I just think that there's a moment in time where, because I talk to people all the time. I'm just surprised at how many people don't know what is possible on video.
Well, one thing is YouTube has made a huge difference.
Sure.
Don't you think it has made a huge impact?
Yeah.
On everybody.
Especially when you hear a video, somebody on YouTube making millions of dollars a year. And you're going, how in the heck does that even happen? Google doesn't even make money on YouTube.
Right. Right.
There's a lot of overhead and costs associated with YouTube that Google still hasn't recouped yet. So
I can imagine. Well,
YouTube's free.
I know.
How much video and storage requirements are in place right now? How many videos are actually there that they just paid for?
There's no telling.
Yeah.
They've got to have a huge, enormous, just one big old huge building just dedicated to YouTube.
Yeah.
I would think. I don't know.
Well, let's wrap this show up, and
okay.
Don't go away, Steve. We can chat a little bit afterwards, but I just want to thank you, Baker Seniors. If you haven't connected with Steve Baker, do so. You owe it to yourself, your parents, your sister, brother, anybody that that has Medicare coverage and also needs some direction and assistance, or even just ask a question. Steve's available. There's no charge for policy review or anything like that. So asking a question is free. Smiles are free. And you can get some more information that potentially could save you some money, which is always a good thing. So thanks for everything, Steve. Thanks for everything you do. And I really appreciate it. Every Thursday, Steve's here at 5 p.m. Central Time. And Healthcare Peace of Mind with Steve Baker. Thank you, everyone.
Thanks. Bye.